evening and welcome to the Urban Debate. Tonight we raise a very serious issue. In Tamil Nadu, a 24-year-old expecting mother found out that she has been given HIV-infected blood. Here is how that horror unfolded, and believe me, it's one of the scariest, biggest botch-up of recent times. Now in 2016, that's where this story begins. A man went to donate blood at a donation drive in 2016. He gave his blood, went back home. The testing authority there found out that he is HIV positive. They didn't tell him. We are told it's not their job to tell him. They informed the local authorities, the local state AIDS authority, that this man is HIV positive. Please carry out this treatment. Please inform him about it. Nothing gets done. We don't know since then till now how many times has this HIV patient given blood. He didn't know he had HIV. On 30th November, the same donor gives blood again in a donation drive. On 3rd of December, this blood is then given to a pregnant woman. Days later, the donor, who's an HIV patient, gets a medical exam done for a visa application. He has to travel abroad. For that, he needs to get a routine exam done. That's when he discovers that his blood has tested HIV positive. It all comes back to him then. He goes running back to the health department. He goes running back to the hospital where he donated his blood earlier. And he tells them what he has just discovered. Even as he tackles and handles and comes to terms with his own trauma, this man thought it was important that the authorities know that the blood that he has donated should not be given to anybody else. The health department then traces the blood to this 24-year-old pregnant woman. Now here are multiple issues. Two very big lapses as I see, but we will ask our panelists more about it. Firstly, in 2016, when they found out that he was infected with the HIV virus, nobody did anything about it. They did not inform him. They did not alert him. They did not carry out his counseling or treatment. In 2018, when he again gave blood, it clearly failed all the checks and balances that are there in the system, because the same infected blood somehow reached an expecting mother. So tonight, viewers, we have very specific questions to ask. Just how much can we trust this entire system of blood donation and transfusion? Remember, getting a disease like AIDS is a life-altering moment. Could also be fatal. Can we really trust the checks and balances? What are these checks and balances? What is really the procedure here? What should be the precaution that we as citizens, as consumers, as patients take? Let's say good evening to our panelists. Kovai Satyan, spokesperson for AIADMK, joins us this evening. Dr. Ishwar Gilada, president of the AIDS Society of India, is with me in the studios. Dr. Zareen Bharucha, pathologist and chairperson of the Federation of Bombay Blood Banks. Kavita Ashok, a citizen voice, joins us this evening. Dr. Mosim Wali, former honorary physician to the President of India. Shriram Khanna, also a consumer voice, with us this evening. But Dr. Gilada, let me start with you first. If you could just explain to our viewers, as a responsible citizen, if I go tomorrow to donate blood, they take a sample. We generally assume they'll do a couple of tests. They'll take our blood, and that's about it. We don't think much about it. What is the process from there on?
See, the process in blood bank is they first check your hemoglobin. If hemoglobin is all right, then they take your blood. Blood is checked for hepatitis B, hepatitis C, VDRL for syphilis, HIV, and then if it is negative, then that blood is transfused to the recipient. that is cleared as a HIV free or infection free blood. They also take a donor deferral form, taking a history of the person, sexual history, or a lot of people may not write anything on that. The issue here is mainly if suppose somebody is found positive, that person has been not told that he is positive, because blood banks say that we are doing only a simple screening test, we are not doing confirmatory test. What I have been fighting for last 30 years or 32 years now, that if somebody has come with a own good solution of donating blood to save somebody's life, is it not the duty of the blood bank or a doctor or a medical system to inform that person, look, you have come with a good intention, but your blood is positive. Or if your blood is question mark, then please go here and there for checkup. Dr. Zareen Barucha is on the panel. She will agree with me that 30 years before, when she was at JJ Hospital running the blood bank, at that time she used to refer HIV positive person found to our clinic in JJ Hospital. So that was a system of linkages 30 years back, and even today that linkages are not well established. We have been fighting that there has to be a good linkage between finding out either question mark positive or real positive to treatment and care. It is not only for HIV, it is also for hepatitis B and C. Hepatitis C is completely curable. So if somebody comes and donates blood and found hepatitis C positive, that person should be provided treatment. Within 3 months, that person become negative. Hepatitis B is vaccine preventable. Today, the biggest effort is to collect blood sample and test.
Yes.
If somebody is tested negative, you tell that person that you are hepatitis B negative, take vaccine.
Yes.
Today, vaccines are given to all children born after 2008. But those who are born before that, they are not vaccinated against hepatitis B. And hepatitis B is 100 times more transmissible than HIV.
Yes.
Hepatitis C is 10 times more transmissible than HIV. So we are basically reckless. And we are talking that blood banks are holy cows and they are saving somebody's life. Gone are these days when there was a movie called Amar Akbar Anthony. Mother was lying in between and blood was coming from 3 of them going in. That happened only in cinema. It cannot happen in real sense. But in rural areas, still a lot of people take blood from somebody, do cross matching and use blood. It is not happening in a big way. 98% of the blood supply in the country is clean. And that too, it started happening after our PIL in Bombay High Court. It was not even called PIL at that time in 1988. But it took almost 10 years time to reach to Supreme Court, and Supreme Court issued guideline in 1998 that all over the country blood banks must screen for HIV.
Right. So let me take that point that you mentioned to Dr. Zareen and ask her, Dr. Zareen, so what happens when the blood bank discovers that some blood that they've got from a donor is HIV positive or infected with any of the other dangerous viruses?
Well, you know, all the donors are tested. But before testing also, nowadays we have asked the donors to be counseled. A counselor asks them questions regarding their lifestyle. And therefore, it is very important for us that the social or community members know about it. The community members should know that now National Blood Policy has said that we should have only voluntary blood donors and not replacement donors. Why? Because voluntary blood donors are thought to be safer because they will give correct answers to the questions asked. And the blood bank which is going to collect the blood will know what is the lifestyle that the donor is going from. And that is very important because that, if that is done properly, we can reach a zero risk level. After the blood is collected or before the blood is collected, because of the confidentiality reasons, the donor is asked in a consent form whether he wants to know his test results or not. There are many people even today who know that they may be suffering from HIV, and just to make sure that whether their test is positive or negative, they go to donate blood. And that should not be happening. And that is what we should create an awareness amongst the society. That they should, such people should not be donating.
I agree with you.
Whatever questions are asked,
Dr. Zareen, I agree with you, but
replied.
I'm sorry I'm interrupting because a couple of things that you said are concerning me even more right now, and which is why I'm asking you this. Firstly, once the blood bank has found out that whoever came and gave them blood was HIV positive, in this case we are told that they informed the local ICTC authorities, and it was their responsibility to counsel, to inform the donor, to counsel the donor,
Yes.
and carry out the treatment. But what happens to that blood? For example, the second time when this donor has gone either to the same place or another place and given blood, somehow that HIV infected blood has reached another patient. Where do you see the lapse there?
The thing is that if the test is found positive, then the ICTCs are informed for post-donation counseling.
Right.
To take care of that patient as HIV positive, not for pre-donation. Pre-donation counseling has to be done in the blood bank before the test is done. After the test is done, if it is before the test is done, the blood is kept in a separate area so that that blood by chance does not get issued before the test results are out. And after the test results are out, those blood which are positive have to be segregated and kept in a separate fridge, so that that blood cannot be used. And it is labeled as HIV positive for discarding. So it should not, in normal case, go for transfusion.
But which has not happened in this case.
That is what I'm trying to say.
So
The tests which are done.
Yes. So let's take that point.
Yes,
so firstly,
but
we are establishing that they should have been.
Because somebody forgot to label it.
Somebody forgot to label it HIV positive. I can't even imagine
it as HIV positive.
Yes, and I can't even imagine that it could be so simple, in such a simple mistake that ruins multiple lives, because this blood has now gone out. And we know of only one case, but we don't even know how many times this patient has actually donated blood in those 2 years, and to how many people it has already gone. The government is still trying to find that out. The other aspect I want to understand, and Dr. Mohsin Wali, maybe you can help us, are there any checks and balances once this blood reaches the hospital, or are we only banking on the blood bank or the lab that's collecting the blood to do all the tests? If a doctor has given this blood, Dr. Wali, to an expecting mother, is there anybody in the hospital who's also doing a check?
No, you see, the blood receiving for transfusion is always in an emergency as a life-saving process. The only thing which they are very serious about is to match that it is the correct, meant for the correct person to be transfused. I remember a case in which former Prime Minister of India was with me in US, and his date of birth was wrongly typed on the bottle label, and the nurses, despite being told that this is the real blood which has come for my patient, they did not transfuse. So it is the check at the identity of the recipient, but they're not supposed to doubt about the blood bank which has processed this blood, supplied to them for safe transfusion. In fact, in these cases, there were 2 lives at the stake. It is not one patient at stake who is receiving. And this, I would treat as a gross misbehavior on the part of the person who thought it is not my duty to inform the donor. It is rubbish. There is nowhere written who will inform. As soon as a person is found suffering or found positive of any of these infections which we are talking, the person who detects it first, it is his moral duty and professional duty to inform all the authorities, including the donor. I do not weigh much of the secrecy clause and the undertakings given by the donor. It is the life of the other side of the donor which is at stake, not the donor's life first. So despite the ruling, despite the clause of confidentiality, if the blood sample is found positive, first of all, such a person should not have been bled for donation. If at all the blood has been collected and not segregated, or segregated, even then, the person who has found and detected, it is his group, team, whole, everybody's responsibility. Technician, doctor, staff nurse, everybody working in that station or the blood bank. Everybody is equally responsible because we believe in teamwork. And through our filter, nothing should go wrong. Intentionally or even intentionally, the blood bank has to do a zero error job.
Okay, so that's...
This is very important as far as I'm concerned, in my opinion.
Yes, so one way that we
Yes.
see blood donation be carried out is obviously through the blood banks and the NGOs who organize these donation drives. The other is when people donate blood.
Misbehavior of the person who is technical person who detected.
The other option, yes, Dr. Wali, is also when you go and donate blood because one of your relative needs blood, and then the hospital tells you that one of you will have to give some blood, and then we can start transfusing the blood. In this case, what has happened is on 30th November, the HIV infected person donated blood at the Sivakasi government hospital. The blood was then stored at the blood bank, labeled safe by the technicians, and it was then transfused to a pregnant woman. This has happened. This blood was taken in a government hospital.
This was wrong.
Who do we hold accountable here?
How can they label that blood as safe? The technician who does the testing, the laboratory attached to the blood bank, both are equally responsible. And who has labeled this blood as safe? No. And the second thing, madam, it is not the same blood is going to be transfused which I am donating for patient X.
Absolutely.
It is the blood bank's stored blood which is normally given in replacement to the one which donates.
Yes.
So it's not that the same blood has to go as people think that we have donated for our son, my son is getting my blood. No, 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 no.
Yes.
It is the duty of the blood bank to supply at appropriate time. Most of the time the donation comes later and the blood bank gives the blood in emergency earlier.
Yes.
On the understanding that such and such person would kindly donate in lieu of the blood which they have given.
Absolutely. So let me ask this question to Mr. Kovai Satin.
Total nonsense.
Mr. Kovai Satin,
really disown this kind of thing.
Will you admit that there is also a state failure here because the authorities, the ICTC team was informed in 2016 and they did nothing about it. For 2 years, this patient was not told that he's been infected with HIV.
Can we,
not a file work.
As soon as this news came and we verified
like
from our sources, we are equally at a state of shock. Yes, we can empathize with a mother who has got a million dreams about about her upcoming child. The Chief Minister, the Health Minister and everybody are equally at a state of shock having come to know about this. But yes, collectively everybody has to own up responsibilities. Just because that everything is going good and we cannot boast about or just beat saying that is everything happening good. But whenever there is anything which has come to our knowledge of this magnitude, everybody stands up and owns the responsibility. Being a part of it, where the Chief Minister also under the Health Minister's guidance has deputed a team and they are thoroughly going through the investigation part of it. So to come to the point whether this blood donor gave it on 2016 and probably there was a flaw in giving the information, let me share my personal experience. I'm a blood donor. Yes, I have donated a couple of times in private hospitals as well, but none of the occasions I was called to say that you are fine, everything seems to be fine or something seems to be wrong. So as one gentleman was pointing out earlier, it is not the moment I give my blood, it has been transmitted to the recipient. Yes, the blood banks do a process of, either it is the last in first out, LIFO we call it, and there is a process in place. So we expect that, the process are being followed sacrosanct and there is no deviation on it. And the technicians who are qualified to do the process give utmost care and importance because this is a life-saving process which he is doing. So having said so, we have taken this up very seriously and our team is on the job. And we assure you that the system and mechanics that needs to be put in place will definitely be there in due course.
Which is what? Please explain to us, because I also as a citizen just want to understand that am I being told tonight that there is only one place where there is a check that happens between the entire process of donation and blood transfusion, that if one technician makes a mistake, There is no other way of detecting that mistake, and that blood can then go on to multiple people and patients and ruin many, many lives. I want to understand how many checks and balances will you put in place, Mr. Kovai?
Tanvi, we are talking about two scenarios here. One is there is an existing NACO guidelines which needs to be strictly adhered to, right? So there are guidelines and there are systems already in place. The first thing which needs to be looked into is whether this process, the clinical process, are being adhered diligently. Whether people are being trained to follow this, are they following it, and what are the checks and mechanisms that is being in place, and how it has been accounted for. That's one thing. Second thing is, we are talking about something like one gentleman is saying it has to be a zero error place, which means that, for example, if you take in a manufacturing sector, we talk about 6 sigmas. He is talking about 12 sigmas, and we are referring to something called a total quality management, TQM, here. So being in a service industry, yes, we need to bring in better practices that is prevalent across the globe, and we have to introduce. And Tamil Nadu, being one of the pioneers in health department, is definitely looking forward for areas of development, not only in this one, for neonatal care or premature babies, or for name anything in the health sector. They are willing to do the changes at the earliest. And I'm sure that the health minister also given a word. This is a state where almost close to 8 lakh people donate blood, and which is being given to 1.2 million, 12 lakh people in a year. And this is the same state which there are about 4 lakh tests being conducted on ELISA, and people are being counseled for who are being tested positive. So the magnitude is large. This is one of the biggest blood donating state.
Yes.
So I can say that we are looking at best industry practices to be in place, so that these kinds of incidences don't occur. We cannot every time say that it's a human error which has caused, and we need to look at this parameter.
Okay, so I'm going to ask some of our other our panelists, Mr. Satil, to help us see what more checks and balances can be put in place. But let me get in few more citizen consumer voices as well on this. And I'm going to start with Kavita. So, Kavita, this is slightly concerning, because we're just finding out that there can be multiple lapses that happen in the entire process system.
Yeah, Tanvi, it's really shocking, because I just shudder to think that, every one of us at some point of life is at this stage, when we are at a hospital or a clinic in emergency or something, some accident or some, delivery of a baby or something, and where we are looking at the blood bank, and we are trusting our lives, we are exposing ourselves to unknown, threat to our lives, maybe like this case of HIV and AIDS. So what I'm saying is that, as a citizen, thank you for the opportunity, because here I'm voicing everyone who goes to a hospital with a full trust that I am here and everything is going, we are entrusting the hospitals to give us a safe treatment. Now, this kind of a negligent behavior that a clinic or a state hospital or a private clinic has exhibited in this particular case is very shameful. And I really feel, what do we talk of human right? This is also human right. There should be stricter laws. And I think, maybe the clinics, the blood banks, the doctors, everyone should be held responsible for it. Yes. So that it sets an example, and it has to be filtered down, in every medical setup, so that another error like this does not happen. Because human life is really becoming very cheap in India, especially. Human life has become very cheap. There is no value, and nobody is even bothered to listen to us now.
Yes, and Shriyam Khanna, this is not even one of those cases where you can, where any kind of a legal battle or a consumer battle is going to make any difference. No amount of compensation, no amount of any damage control can work once a life is destroyed, once you've been infected with such a serious virus. So what do you think needs can be really done to ensure that less and less mistakes happen? In fact, I was just reading a report from Times of India in 2016 that said that the National AIDS Control Organization stated 2,234 people contracted HIV in the country because of transfusion of infected blood. So this is not a new thing.
Well, let me say, The responsibility squarely lies in the shoulders of the Union Health Ministry, which manages NACO, the health ministers and health ministries of each state government, including the state government of Tamil Nadu, and the professionals who are manning the public sector hospitals and the labs connected thereto, and the managers of blood banks in the public sector and the private sector. This is not a small issue that somebody is lying in the operation theater fighting for life and goes and gets blood from the blood bank and gets infected in that process. This is, if it has happened in Tamil Nadu, it appears to have happened out of negligence. The first thing they need to do is, before they take any other action, is to ensure that an FIR is lodged with the police, alleging negligence on the part of people who did not follow the due process or who were negligent in following the process, as a result of which infected blood was stored in the blood bank. And then after that, they must make sure that the protocols which the NACO has laid down, the protocols laid down by for the blood banks, they are honestly and scrupulously followed. Let's not also forget that Tamil Nadu and Gujarat are the top two states where blood donations and organ donations are the highest in the country. So I salute the blood donors of Tamil Nadu. But it appears that this enthusiasm of blood donors has created complacency in the blood banks, who are not ensuring that the blood they take is infection-free. And that is where the Achilles heel lies, and that is where the Ministry of Health of Tamil Nadu and the Central Ministry of Health and the NACO need to work along with these blood banks to make sure that not a single person is infected with AIDS through blood banks. And that is the job of the Union Ministry of Health, the NACO and the Ministries of Health of the state governments. They have joint responsibility.
Yes.
And you cannot let it go. You have to create an example and punish people who are responsible and yet take action to make sure that it does not happen again. It's a very serious matter.
Yes, and I'm going to reiterate this because while my heart goes out to the donor in this specific case, who also is now coming to terms with the fact that he has HIV, his blood has tested HIV positive, he has still taken the effort in the last few days to run around and to go from one authority to the other, telling them that, look, I have just discovered this from the health department to the hospital and the blood bank, to say, this is what I have, I donated blood to you, I don't know if you found out, but I just found out that I'm HIV infected, please don't give that blood to somebody else. He did this. That's how this came to light. Not because any blood bank, not because any path lab, not because any government authority, not because of the state AIDS authority realizing this, and they all systematically failed not just this man, but also the 24-year-old who was given that blood. And if it wasn't for this man, he could have, might as well just gone ahead with for his own treatment and never thought about this. And we would have never found out that blood could have gone to more patients. So this is a larger failure that has happened. Kavita Ashok wanted to come in. Go ahead, please.
Or you would have feared.
Yes.
Yeah. Tanvi, I want to, I'm in appreciation of this particular person that you're mentioning, that look at the awareness of this particular man, the citizen, how he has come forward and even thinking about the other person who must have got his infected blood. So, he is like really deserves a salute from all of us. While the whole medical system has failed, this man has won, because he's trying to save another person's life. So beautiful. And secondly, because I do some, I understand how free health checkup camps are done here in India. So I also want to bring in the point that what about the free health checkup camps where there's a lot of blood donation going on, in all the slum areas and poor areas. Now if the private clinics have no safety net, what is the safety and the, the correctness of blood donation happening in these camps? In the free blood donation camps where blood is, exchanged and taken. And so, there's a whole lot of confusion as part of citizens that I really feel all of us would be feeling very worried whether next time we go to a hospital or we need blood, are we safe to take the blood or to refuse it, as, I just feel.
Dr. Zareen, would you want to address?
Scary for all of us.
Yes, I completely agree with Kavita, and I don't want to unnecessarily cause panic here, but there will be questions that people have. Dr. Zareen, please.
Yes.
Yes. See, the thing is like this as far as the blood bank is concerned. It's not only the blood bank fault. I think it is the fault of all of us around. First is the social community who is not aware of the things that the voluntary donors only have to donate. Secondly, the National Blood Policy has very clearly said that it is not the patient and the relatives that should be responsible for blood. It is the hospital which is responsible. And why is that so? Because we didn't want the replacement to go on. Because if you insist or if you coerce the patient's relatives that they have to donate blood, then they may not give correct history at the time of donation. And that's why that should not happen, and the hospital should take responsibility of getting voluntary donors and provide that blood. Another thing is that the blood bank staff has to be properly trained, and there should be proper quality assurance going on in the blood bank. Nowadays, we are even conducting external quality assessment of all the blood banks. And all blood banks should undergo such tests so that they know that whatever tests that they are doing is also correct. And thirdly, it is also the responsibility, as said earlier, of the government.
Yes.
We have 3,000 blood banks all around the country. Are there any such numbers in any other country except for here? And I'm sure within a year or two it may become 3,500 also, the way the blood banks are being formed. And that is why we do not even have enough staff in the drug control department to inspect those blood banks and to see what is happening. So even that needs to be controlled. And that is, these things if we look into, then it is not the only blood bank which is responsible. Blood bank is definitely responsible for doing the correct testing and asking the correct questions to the donors. Maybe in this case also, the donor came to know later on that he is HIV positive. But how did he get HIV? He must have known some things that he was doing. Either he was a drug user, or he was tattooed, or he was going to CSWs and all sorts of lifestyle questions. Did he ask himself how he got HIV? That is what is important also. That's why it is very necessary to make people aware how they can get HIV.
Well, I don't know. Maybe I don't know. Maybe he got blood which was infected somewhere.
Through dental treatment.
Because what I am discovering tonight is that between the donation and giving it the transfusion to a patient, the blood is tested only once. Doctor, and if you are testing the blood only once, is it a foolproof mechanism?
No, Tanvi, basically at the testing level, they test once if it is negative. They test 3 times if it is positive. So basically the system there is not at fault, but in the entire system, there is a system fault, there is a FDA fault, and there is an individual fault. In system fault, there should have been a system to destroy HIV positive blood immediately or use it only for research purpose. Because for research purpose, they always need HIV positive blood, hepatitis B blood, or C positive blood. So that should have been done, but there is no such system. Secondly, there has to be linkages. Because if somebody is found positive, you double check, triple check, because the person has come to save somebody's life. You cannot be reckless with him. Thirdly, in the system of checking blood, we are doing only antibody test, which detects only after 3 months.
Yes.
So in between, suppose somebody had HIV infection yesterday, till 3 months he is found positive, he can still infect.
You have actually raised a very important point, doctor. And I want
so there you need to do a good test which is called NAT, nucleic acid amplification test, or NAAT or NAT. So in that test, it is found out within 2 weeks time. Initially, it was thought that the test is very expensive, it should not be done. But it is 200 to 300
So let me also just explain to our viewers, and I also just discovered this afternoon when we were researching more on this story, that often it takes several weeks up to 3 months for the infection to show in the regular test.
Yeah.
So if I got an HIV infection, say a week ago, and today I go and donate blood, it will not show up in my test. It may not show up in my test for the next 2-3 months.
3 months.
But by then that blood has been taken, put in the bank and sent somewhere.
Yeah.
So what percentage of our blood banks or labs are actually doing the other NAT tests that you're talking about?
That have done by very few labs, maybe not even 5% of the labs in the country.
How are we allowing this?
Because it is expensive accordingly, but it is not very expensive. It is 300 rupees more than that. But there is a solution to that. There can be a pool testing. You're pulling 8 samples, doing it together. If that is positive, then you test all 8. If that is negative, all 8 are negative. Because it's a very, very sensitive test. It amplifies the virus. So it is even in microorganism, micro level it is positive, it will be showing.
But I am told that no blood bank keeps that sample for more than a week. So
No, even if sample is kept for 1 week or 2 weeks or 3 weeks, at the level of testing, if it is in window period, you will not find it.
Yes.
Unless until you are using a expensive test or little expensive test called NAT. The third problem or fourth problem now is, if somebody is found guilty, what is the punishment for that person? Now there is a act which is called HIV/AIDS Act 2017. With that act, which is initially it was bill, the person who is reckless can be punished. So we must try that person whosoever is a technician.
There should be criminal prosecution in that case.
Yeah, prosecute.
Yes.
Unless and until we do that, because such test is a eye-opener test for all of us. But it's also a stock-taking situation.
Yes, because you were telling me that there was an instance in the late 90s where one of the technicians was just so upset with the system that they decided to label everything negative.
473 people were given knowingly blood transfusion, which was HIV positive blood. The technician at a very reputed blood bank of Red Cross in Mumbai, he labeled all them as a fit for transfusion. Only at one hospital they found that how come the same number of blood bottle is issued yesterday and today, and they found out that technician was doing that. And when we contacted that technician, they said we are not paid salary for last so many months.
Well, we definitely need a more foolproof system that a single unhappy, disgruntled employee cannot get through and break through and destroy like this. Dr. Nilesh Ankleshwar is on the phone line calling us from Gujarat. Let me see if I can go across to him. Good evening, Dr. Nilesh.
Yeah, good evening. I want to make 2 points. There is a cost factor. Ultimately, what lies whenever we want to have something cheap, we bring down the quality down. We don't. Most of the blood bank in our country are not monitored by pathologists themselves. They are writing on the paper, they sign on the paper, but their reporting is not done by pathologists because blood banks do not have money to pay the full-time pathologist. Second, why don't the sample can be tested at a centralized laboratory anywhere in Delhi, Bombay, Ahmedabad or something like 4 major centers. Nowadays, many ThyroCare, Dr. Lal laboratories are sending samples. Why don't random sampling can be done from the blood banks to the centralized center so that they can be double checked? The random sampling will ensure that technician at the primary blood bank level will ultimately test because he knows that my sample is going to be tested again. And that is the best solution I can see that we can offer.
All right. Actually, you've raised a very important point. So thank you for calling. And I'm going to take that point to Dr. Wali. Dr. Wali, it is emerging that perhaps we could have a better system in place if we were not so cost conscious. If we are willing to add a cost to it, which we should, because these are lives we are talking about, we could have a test which was more sure and we could have at least double check system in place.
It is always wrong to talk about the cost because when something comes to somebody's life, the cost is secondary. Totally irrelevant. Cost issues are totally irrelevant, and I am very much pained to know what was the blood bank doing between 30th November and 3rd December, and who was this great man who just slept well after informing the local state authorities. These are the 2 very important questions raised in your show today, and they should be very, very strictly and dealt with criminal approach. It is a crime. It is a crime. I would repeat, it is a crime. Cost doesn't come. You see, our officers of the blood bank, they move in costly cars. They spend so much money on petrol, I've seen all the time. I'm not suppressing the fact.
Yes.
These officers go and they spend so much money on petrol and on tours, and they have costly buses, they have costly offices. So why think about 300 rupees for a man's life, of a woman's life? And in this case, there were 2 lives involved.
Yes.
I'm very sorry. You see, we raise so many issues on paper which are irrelevant, and life has to be most important. And the job at which these people are kept, they should be thoroughly groomed. This grooming is not taking place. The duty go back when their time is finished. They do not know how important thing which is related to the life of someone and the future of this country is in their hands. They should be told, they should be groomed, and their officers should take pains. It is not just they come in the blood bank, sit, pass time, have lunch, go back home. No, they have more important job than the surgeon operating, than the gynecologist operating, than the person who is treating the patient, doing the technicians of the blood bank, and the doctor sitting there supervising the technical staff has to feel involved as if it is his own patient, his own father or mother. Till such this thing happens, till such time this thing happens, we shall not get the benefit of rules, guidelines made by Supreme Court, guidelines made by Health Ministry or anyone else. We should feel involved, we should feel involved, we should feel involved, and we should save the lives with full sincerity.
Yes,
I have worked with 3 presidents and I have seen that day and night it is nothing but duty comes first, which is not the case today in the professionals, due to which the nation is suffering and we are suffering, and you are.
That's a very, very valid point there,
which is totally
Dr. Wali, that
for.
you said that, you know, that official who found out, the technician, and just passed on the information to the ICTI and didn't do anything about it, and the blood bank who took the blood
This
again
is rubbish.
in
This is
2018
nonsense.
should have shown some more. And Kovai Satyan, maybe you can.
It is not a government file to be sent.
Yes.
It is not a government file to be sent.
So how do you ensure
it is a life
that there is
signal,
accountability here and this doesn't happen again? Kovai.
Grooming.
Two things which I want to clarify here. The first thing what the government did is they sent across their health experts and protected the child in the womb from getting infected from the mother. And the mother has been assured as the best of the treatments in days to come. And the lab technicians and the person who are associated are dismissed from their service, and yes, they are going to be tried legally as well. I think 2 counts of FIRs have been filed against them. And third thing is the department is already pressing in a panel of doctors have been appointed, and they are going into the root cause analysis of what went wrong, what went right. To throw light on this incident, I think the person came and gave the blood during the month of August, and by then he came back and gave the narrative saying that he has been infected. It is the department official who traced the mother and did the best of the service at that point of time. So I have been listening to the different panelists who are talking about the best practices that needs to be put in. I think a doctor from Gujarat said that there has to be a random sampling and pathologist has to be appointed. There is another gentleman who said that yes, cost should not be associated when it comes to saving lives. All these points are taken down. Yes, definitely this government is not only looking this as one such incident. It has taken this very seriously. The Chief Minister and Health Minister has taken this very seriously, and they have taken the accountability as well to bring in the best practices possible, which is prevalent across the globe.
So here is what you need to do, and this is actually not just for you, Mr. Kovai Satyan.
Government is doing the best.
Yes, and this is not just for your party and your government, but this is actually something that we need to raise at a national level. This other aspect that has emerged, not just of the checks and balances, but let me finish my point, please. The fact that Dr. Ishwar raised,
like a panic button being pressed.
No, I think a panic button needs to be pressed. And I think the panic button needs to be pressed at a national level.
Program rather than a blame game,
because we are being this is not a blame game. Yes, because we are being told tonight that there is only one check that happens, at the lab, and that's that. And after that, if there is a mistake there, it can never be corrected because nobody ever will check it out, and it just goes. We are also being told that there is a possibility of a 3-month window for the HIV virus to show up in the test that's usually done.
Period. Window period is very important.
Yes. So, Dr. Zareen, the fact of the matter is nobody is keeping the blood and testing it 3 months later, are we? We are testing the blood as it comes in, and if it's negative, then we are sending it out. Nobody is waiting for the 3-month window period, are we?
I want to add.
I'll come to you after this.
Like to say here.
What I would like
Dr. Zareen, please, and then I'll go to Mr. Sriram Khanna. Yes, Dr. Zareen first.
And ICMR.
And then Sriram Khanna.
What I'm saying is, see, there is a need to change the testing protocol.
Yes.
The ICMR as well as the NACO need to come together and create a new protocol or improve the existing testing protocol to ensure that there is a double check after the blood has been donated and assumed and after testing by the blood bank that it's okay and it's negative.
Yes.
There should be a random testing and the cost of that testing should be defrayed in such a manner that the economy of the blood bank does not break down. So we need to create another layer of what we call proficiency testing to ensure that the tests are carried out, and every blood bank is scared that if they are careless, they will be caught. In our country, you know, there is a Hindi saying, "Bhai bin preet na koi," that if the people who are doing the work, they have no fear, then they will not also love you. So the people working in the blood bank should know that our blood that we have taken, which we are saying is okay and ready to donate to another patient, will be tested again. And I support Dr. Wali's suggestion, and I hope that this suggestion is taken. And I'm also happy to hear the representative from Tamil Nadu. Sir, you have taken some steps, but perhaps you need to write a letter to the Union Health Ministry documenting your experience and telling them what you have done and advising them what they should do in other states. It's not only about Tamil Nadu.
Yes.
This is valid for every state in the country.
Absolutely, absolutely. Dr. Ishwar, you wanted to come in, and then I'll go to Kavita.
Yeah, I wanted to raise two more issues. One is, in all this melee, we are forgetting the victim. How the victim should be best treated. Currently, some best drugs are not available in NACO system. In such situation, if she has to prevent mother-to-child transmission, somebody should come in, and we don't mind taking up that expenses of treating her in best possible way so that mother should not transmit to child.
Yes.
Number two is, Kavita has raised the issue and put a question mark on blood transfusion system or blood donation camps. Lot of people do not understand what is transfusion. Taking is transfusion or giving is transfusion. We must clarify that blood giving is no risk.
Yes.
So people should continue donating blood. Otherwise, with such program, people stop donating blood. They think that by going to blood bank, we will pick up some infection.
Yes.
A very good system has been introduced where there is a blood bags. There are no blood bottles. Earlier, it should be bottle. And the black bags have to be used only once. So while taking blood, there is no risk at all.
Yes.
While giving, yes, there has to be checks and balances, and there has to be system. As Dr. I think somebody suggested that there should be another check. It is going to be impossible. Nobody can have, you cannot put a onus on doctor or hospital because they are going to take a FDA certified blood bank bag as whatever they are saying, certified.
Yes. Okay, so maybe the accountability of those who are doing the test has to increase. Dr. Zareen, I'm running out of time, but go ahead please, you wanted to make a point.
I wanted to make a point.
Yes.
Here, see the blood, when HIV came in 1989, when we started the HIV testing, we had zonal centers. And the zonal centers used to get everybody's blood samples and test and give the report. I think the time has come when we need to do that, because there is a net test which has come in which can detect the HIV much earlier. The window period is much lower. Cost is more, but then as is said, we are not only depending on the cost, we also want to see that less of HIV occurs through the transfusion. So net would be important that way. Why? Because all blood banks are not having good counseling of the donors. And the donors who come to donate blood are not aware as to why they are asked not to donate blood. So with all this, if zonal testing can start, I think we can do much better. And that's what we need to introduce now with better testing levels.
Yes,
Because
and I also
all
know,
over
I'm
the
sorry I'm
country,
interrupting
there
you,
are
but I'm running out of
different
time
levels of
here.
blood bank.
But I
There are
also
blood
want to
banks
highlight the
which
fact
do
that
good.
sometimes we just go overboard in our donation drives, where we sometimes don't bother to do all our proper checks and balances. For example, I don't understand that if there has to be a background medical check, how is it just being done verbally, where you're simply asking the person if you've ever had yourself tested, or if you've had XYZ problem, tell us about it. You can't just depend on the donor to either know the details or to even honestly tell you the details. There has to be a better way of doing that background medical checkup. Secondly, while it may be a logistical and a cost nightmare, but these are lives of people we are talking about. So if there is a better, a more sure shot HIV test that can be brought into place, then I don't think the government needs to even think twice about it. It must be done now. If we know that there is a possibility that if you do another test, you could reduce the risk of HIV infection through blood transfusion, then it should be made mandatory right away. And the union government needs to wake up and take this call. One can only hope that there is more accountability of the technicians at the blood banks, that when they do the tests, they do an honest job out of it. And on last note, I just want to tell the donor in this specific case, thank you so much for doing what collectively an entire system failed to do. I also want to tell our viewers that he is obviously not going through a good time. We just found out that he allegedly tried to even kill himself. Maybe, doctor, you can and your society can reach out to him and offer him the help he needs in these troubling, trying times. But we want to just, from our end, thank him for the great work he's done with the multiple times of blood donation and then going back to the government and authorities and alerting them about what had gone wrong. Maybe as citizens, we need to learn from him and we need to show a little bit more responsibility as well. Thank you so much for joining us on this debate.